Now I'm going to be showing you the roll or rolling stroke method. This is great for removing biofilm, material alba, food debris from the teeth, but it does not place emphasis on the gingival sulcus. So this method is usually used in conjunction with the vibratory techniques such as the modified Bass, Charters, and Stillman methods. It can be super helpful if there's any question about the patient's ability to master and practice a more complex method. So to start this one, we're going to direct the filaments apically, like this. We're going to be placing it parallel to and against the attached gingiva, starting like this. And then you'll know that you're at the right placement when the brush head is level with the occlusal plane at the proper height like this. So we're going to be pressing it lightly against the gingiva, making it blanch. Then we're going to roll it slowly. So we're going to be turning our wrist as we roll slowly up over, keeping these filaments flexed against the teeth, getting like a little bit interdental, just like this, just like that. So then we're just going to keep doing this like 4 or 5 times for each tooth or group of teeth. Then, when you need to move on to the next section, you remove the brush, reposition, and rotate that wrist. Just like so. You need to make sure you're overlapping your strokes to really make sure you get in all those teeth. For the anteriors, we're going to again be using the toe of the brush, but use the same technique, pressing it down and up for the mandible, down for the maxillary, and then we're just gonna replace it and repeat this 5 times for each brush width. The limitations on this could include brushing a little too high or low during the initial placement, which could lacerate the alveolar mucosa, and it's really minimal plaque removal interproximally. And patients have a tendency to use quick sweeping strokes, which results in failure to adequately remove plaque biofilm from the cervical third of the tooth because the brush tips pass over rather than into the areas. But again, this is great for adding to these other vibratory techniques to really make sure we're getting the full tooth.